Hello. Hi. I just want to do another video to kind of help, hopefully, other guys who have my problem. Again, I want to emphasize kind of right now that so if about 30% of men have varicocele, um, and 10% of them are ever diagnosed, and most of those, it's usually because of infertility problems. Um, then a small part of that would be people who are diagnosed for physical pain because of the varicocele. And of those, most of them are grade 1. Then there's grade 2 and grade 3 that normally have more problems with that. So I just want to explain what I think the pain is from, so other guys can maybe deal with it. In addition to the simple diagram here, on myself, this is very hard to talk about, but most people that just look at you are kind of quickly looking, not wanting to be too invasive, and they look from the front, or they have you lie down, and then maybe they kind of see underneath, but it's kind of not hanging at the time, or kind of hanging down, and so you don't see how there's a middle skin that divides the scrotum kind of in two, separates the testicles, but this tends to drop down, and in myself especially, over. So what you have is the middle line here. It's moved a whole inch over, and it looks like this testicle has either moved up, or this one has kind of moved into the center. So you have that center skin kind of disappearing between here, and there's kind of a reddish area on myself between here and the testicle. And so when I first videoed that in February 2012, so I kind of, from underneath or from behind, I kind of put a piece of kinesiology tape, and so I kind of tried to tape this back, and tape it around kind of in behind here, in order to bring this skin back to the normal position, and then just kind of reinforce it going up here, just to sort of bring the scrotum back to the original place. And I found that helped quite a bit. I actually had 2 out of 5 pelvic floor strength for about 5 years since before my surgery. I went right away to 3.5 out of 5 strength when I taped it like that. I taped it a little bit differently, not using kinesiology tape at first, and then but I found that was very difficult. But I think for the guys, a lot of the pain is because of the varicose veins in here, and when you squeeze your pelvis and when you walk, you're wrestling those veins in here. That's part of it, but that's kind of a small part of it. The other part is this the cremaster has been kind of elongated, and video 1 talks about that, but that's what I'm talking about, or that's what I think he's talking about, is the traction of the spermatic cord, or the cremaster being lengthened. And now, the cremaster actually attaches to the hip bone here, and when you walk, your legs move back and forth, muscles are squeezing, contracting. They all kind of do this in unison. But what I think is happening here is the cremaster, it's elongated, and so when you try to pull up on that side, it's kind of restricted. Also, it's restricted going through the tube. So you get this downward pulling kind of effect, and I'm just going to stand up here and kind of show you how it affects me. Now, it was my chiropractor who first noticed how I used to stand up, and I kind of lean over, I pull on this, and at the time I was sitting on a perpendicular chair, so I kind of go around the pelvis, and especially the left pelvis. And remember, I do have actually varicocele on the right side that was not addressed, and the left side, I don't want to get into it too much here. slideshow. So as I'm standing up here, um, the blood would be going to the scrotum, but so it's difficult to stand up. This left knee kind of wants to go inward, and so what I feel is happening is um, the hip bone it attaches right around here. So there's kind of a downward pull, or there's also kind of an irritation of the veins and a pulling on the cremaster. So that hip bone is kind of pulled in, and it's not something you think about. I'm going to slow that down. But so the hip bones, as you walk, it's all complicated, and I don't know, they kind of wiggle like that. I'm not a doctor, but when you do the splits, they kind of make room, but those are kind of encased in your skin, and when you pull that hip bone over, it's squeezing what's in between, and um, so there's kind of a squishing of the prostate and whatnot. It's like a pair of scissors. And that middle piece between the scissors, if you squeeze it with a pair of pliers or something, it gets harder to move those scissors, and so I have this kind of effect on my left leg, and so another thing I believe that's bothering the guys is so there's that kind of extra weight. There's kind of that pinging or moving of the scrotum over as you're walking when your left leg hits the ground, then kind of squeezes. And I first noticed symptoms when I was running track and field, and when we went from 7 minutes per mile in warm-up pace to 5 minutes per mile in workout pace, I had the pain right here. So I guess I just want to show this as well, guys. So I've had when I videotaped it, I was throwing up when my sacrum hit the ground. I started just to feel nauseous, feel like going to the bathroom, and uh, and so I would have nausea and vomiting, diarrhea. Um, back then, and so I struggled with that for maybe a year or so. Started using the tape and stuff, and stopped using the tape. Started using gabapentin, Gold Bond. Now I'm using calamine lotion with phenol, prescribed by my doctor. Also, I'm using, and in the last couple of weeks, I've more discovered the importance of using a suppository. And this is pretty gross, but so so you've got the problem with the scrotum kind of moved up and over on the front, and on the back. I think your anus is trying to squeeze to. There's at least a bother when you flex to tense up your muscles. There's a kind of pinging or moving over of the scrotum, and that causes like a pain because the skin, especially that middle skin, is sort of separated and coming together. And when you're clenching, it's hard to clench because number one, you're pulling on the veins on either side in the front, and you're also the skin is being damaged. The cremaster um, is being irritated. I should say irritated. But the anus is kind of cringing because it's causing the pain when it clenches, and so all those wrinkles in there have been prescribed suppositories and steroidal ointment, and so it's pretty gross. But in the last couple of weeks, I've really noticed that. So if I just use the suppository and put it up there, then squeeze it, and then there's a very nice cool relief feeling, but it feels hot in there. You don't really notice it, that it hurts until you touch it, kind of like a scab. But if you use your finger and you kind of push and pull on that skin, you'll find find that the folds in there, when the ointment gets in there, then it kind of stings and burns, but that's therapeutic. And but there's a lot of big wrinkles in there, and then when the ointment gets in there, when the finger gets in there, it really hurts. But just putting the suppository in there and out um, gives you some relief. But I've had it's helped a lot lately to actually put your finger in there and kind of massage it into the cracks and massage out the cracks, and that's a lot of the pain I've been having. So I skipped after I was prescribed the gold bond and stuff. Um, I stopped using tape because that was getting problematic in eczema with the skin. So I used a ring around, it goes like right around the penis, right around the scrotum. Kind of supports that skin, and it isolates that skin that's being overstretched, and it gives it a little bit of lift and a little bit of support. And so last couple days I stopped using it, and I tried to do my exercises without this, and then I would put it back on. But I've been diagnosed with myofascial pain. So um, the myofascial pain, if you Google the um, the fascia talk, or I'll get to it later. But it's a video talking about fascia, and he talks about how myofascial pain basically works, I guess. And so so the problem we've kind of got is um, the, the problem with the legs not working properly when you're walking, and the wrestling of the skin, the pulling it back and forth, as you kind of get in grooves and ways of moving, your body adapts to that, and then when you try to move in different ways. Um, so this kind of isolates the problem a bit and pulls it in, but the negative of that is you're not stretching the fascia, you're not moving so much throughout the day, so you have to balance. I swim, or I basically, like, I don't move my legs very hard, but I just float and walk and very gently stretch, and so I take this off when I'm in the water, and uh, do kegels and stretching and a lot of squeezing, pulling up and down, pulling the button in towards the spine. See, as soon as I do that, I can feel the tension in here. Um, but I wasn't able to pull the belly button towards the spine really much at all before I started doing it in the water. And it's just an exercise in pain, it seemed like, before that. But this what I did is I made it myself. Is you get the right size. It flexes a little bit. This is double-sided non-stick tape, or it's not double-sided, but non-stick tape. It doesn't stick to your skin, but it sticks to itself. So you just make a ring with it, and then I used this tensor bandage and made it a little smaller, and this also just protects the veins from being rubbed, and it separates your legs a little bit, and because your legs will be irritating it. So this kind of helps with that a little bit. So please, if this has helped you at all, please do that study on part 2 and send it in, because the urologists, they all only have a couple of surgeries that failed, a couple guys that are complaining about the pain associated with varicocele. Most guys won't have most of this type of pain, and depending what you do, because I was a distance runner, the reason I discovered my varicocele or got diagnosed in the first place was after doing Kegels. Then I had burning legs as I was sitting, and after I started doing Kegels, then I also had abdominal pain, and I was trying to deal with the abdominal pain by being centered, and it seemed to help a little bit, but I started feeling a pulling apart in the scrotum. I put on a hockey jock strap. Um, Immediately, especially the next morning, the hip felt looser, and I felt like I lost a belt size overnight. But 3 days later, I was in the shower, and without the supporter, and it started to feel heavier and heavier. And then I felt like I got winded, and I had to go to the ground. First I tried to support it, get the shampoo out of my hair, and then it felt heavier and heavier, and I went to the ground, and that's when I went to my doctor, and he observed varicocele because the sports doctor, he never looked in my shorts before, basically. But I was having trouble tensing up, and he's like, Mike, don't think about it so much, because I was having so many problems. But then he referred me to the surgeon there, and you can see I was diagnosed with grade 4 varicocele, because my veins are big, even though there's only grade 1, 2, and 3 varicocele. But I don't want to ramble on too much. I hope that helps some guys out there. Um, there's only probably like 1 in 100, or 1 in 2 in 100 that even are affected. Um, their surgery doesn't work, and it affects them to varying degrees, because everybody's veins develop differently. The motions that you do every day, the positions that you're in every day, the fascia will kind of form so that you're able to do those things, and then that's why you need to stretch a lot um, to do variable things. But I believe that what you do every day affects how your facial pain develops, and how your varicocele is affecting your balance, your body. And so, basically, um, in order to stand straight, you want to be centered, and to have balance, you want to be centered. But the, um, the anus, the lower pelvic floor, is also trying to adapt to not bother the veins. So you get kind of like a leaning over, kind of like you throw a bowling ball, and you're like kind of like this, but it's more like, oh, that stings, that hurts. And so you're trying to sit in ways, but you don't even consciously know it. The guys were bugging me at the office job because I was always shifty like this. But uh, again, email me, grade 4 varicocele at outlook.com, and I can email you a set of questions. It's in part 2, grade 4 varicocele, and you can see it there. Uh, just ask me questions, send me your information, how it's affected you, because I believe we need to do a study that kind of combines the result of all the guys, and maybe even have a meeting or fly guys in to have kind of a conference on uh, how varicocele affects each person, and how things are similar, how things are different, so that we can kind of get a better idea of how varicocele affects you, and under what circumstances it affects guys. At what point should a person have surgery, even if their varicocele is not bothering them? Or a lot of guys probably don't know it, and you develop a lot of tension, you develop a stiff hip, you don't know it's from a varicocele, then you get hit by a car, and uh, your muscles are all tense, and I believe varicocele can cause, it's a risk factor for all kinds of other injuries. So it's something that needs to be looked at as far as back pain, um, and your ability to hold your hips level, and having problems underneath the spine. We're kind of conditioned to think that, oh, this disc is bad, or this disc is bad, or this disc is bad, and that's the cause of the problem. But, well, something like this in the pelvic floor causing you to lean over and have tension, it's going to maybe, I think, in a lot of cases, the problem isn't the back. The problem is what's under the back, and that's why the back gets injured. But that's all for now.